Hey, are you guys waking up and dealing with neck pain or low back pain? One of the questions we get all the time for patients is, how should I sleep? So I want to run through that with you and then wait to the end because I'm going to tell you something that's probably going to surprise you. So when it comes to sleeping, obviously there's 3 different ways we can do it, right? You can go on your stomach, you can go on either side, or you can sleep on your back. I would imagine if you guys have talked to any healthcare providers before, they've broke these down for you. But hey, this is the best, this is the worst. But we're going to do it again. So Liz is laying down here on the table. This, a majority of the time, is probably the worst way you can sleep. And let's talk about it for a couple reasons. One is when you are laying on your stomach like this, obviously from a pillow neck standpoint, you have to have your head turned all night long. Well, if you're sleeping 7, 8 hours with your neck stuck in one position, even if you flip-flop back and forth, you can imagine what that's going to do for the neck, for the muscles. Things are going to get tight. They're going to get achy, can cause headaches, stuff like that. So this is the main reason why this isn't an ideal situation. The other thing is from a low back perspective, and again, this is going to depend on your bed a little bit, whether it's soft or hard, but when you lay on your stomach, the hips have a tendency to drop down and flatten out. So your low back can actually dip a little bit more than what it should be. So that's why if you look at Liz right now, you can see she's got this bolster underneath. So here's what I tell patients. If you're going to sleep in this position, I want you to at least put a little bit of a pillow underneath the hips, because what that's going to do is prop up the hips and low back a little bit, take some of the pressure off the low back. The other thing I've had patients do before is if they put it underneath the hips, they also put a little pillow underneath the ankles right here, because if we just lift this up just a little, same thing, relaxes everything. It's going to relax that low back a little bit more. So in a perfect scenario, this is not ideal. So this would be the worst position you're sleeping in. Follow me this way. Let's talk about the middle of the road, the second best option. So second best option is sleeping on your side, okay? When you sleep on your side, at least from this standpoint, you can see with Kenya, the head is supported appropriately. And if you sleep on your side, I want you to put a little bolster or a pillow between the knees. This more so for anybody that's dealing with a low back type issue. If we put that bolster between the knees, it's going to help keep the femurs and the hips in line, which is going to help the pelvis stay in line. And then in theory, that's going to come up and relax that low back as well. But I want you to remember, Kenny, you're going to stay here till the end of the video, because then I'm going to come back and use you as another example. How about that? So second best option, if you don't absolutely want to sleep on the stomach, come to this side, put that bolster between the knees and at least keep you a little bit straighter here. Best option, if you can do it. This is the hardest one for everybody, and I'm going to be honest with you, I am guilty of this one as well. To be fair, when I sleep on my back, my 3-year-old the other day looked at me and asked why I sounded like a dinosaur because I was snoring when I was on my back. And I'm okay with that. I just can't sleep on my back. But this is the best position to keep you supported. Couple things we got to pay attention to when we are sleeping on our back like this. To take pressure off the low back again, I want to put a little bit of a bolster or a pillow just underneath the knees, just slightly. So you can see here, her knees just a little bit of bend. And we don't need anything really big, propping up, anything like that. Just enough to relax the hamstrings, to relax that low back. And then again, if you look at Cash, she's got the pillow here. This is not an ideal pillow for this situation, but the head's supported, spine is straight, everything like this. So I'm going to come back to Kenny over there, but here's the deal. Even though this is the best situation, here's what I'm going to tell you. As a chiropractor, and people are going to give me flack for this, and that's okay, I don't care how you sleep. If you are in pain and you're trying to get your body to heal and to feel better, you have to rest. You have to sleep. So if you look at me and say, Dr. Mike, on my stomach is the only way I can actually close my eyes and fall asleep and get 5, 6, 7, 8 hours, then I'm totally okay with that. Sleep on your stomach. I want you to be comfortable. I don't want you to make anything worse, but I also need you to rest so that your body can heal. So from this scenario here, when we're looking flat like this, again, slight bend in the knees, the reason I said this pillow is not ideal is I want the spine in perfect alignment, whereas you can look at Cass's head right now, and her head is propped up. It's like she's doing a little chin tuck on us, and she's not supposed to be. So even with on the back right here, this isn't a perfect scenario. So if we go back to Kenya, if you guys were to look at her from the front, here's what I always tell patients. When you are sleeping, ideally on your back or on the side, I want the spine perfectly level. So if we were looking at her from this side, from the back of the head, down the spine, down into that low back, I want everything level. So I tell patients, lay on your bed, whether it's on your back or on your side, have somebody look at you. So like in this scenario, I'd look at Kenny and say, hey, this pillow's still a little bit too high. Your head's propped up a little bit. Because even though we're comfortable here and the hips are good, if her neck's propped up like this because of the pillow, eventually we're going to have neck pain too, right? So that to me is the biggest thing. I want you guys sleeping no matter what, but if we can, whether you're on your stomach backside, make sure the spine is aligned, have somebody look at it so that everything's nice and level, and we're not creating little kinks in the neck or the low back as you sleep 6 to 8 hours. So there you have it. I don't care how you sleep. I want you comfortable, but if you have any questions, comment down below, hit that follow button, and we'll catch you guys on the next video.